Here's a number that surprised me after 30 years in this business. Miss your Medicare window by just 2 years, and you'll pay $243.50 a month in 2026 instead of $202.90 for as long as you have Medicare. That's not a typo, and it's not a one-time fee. It's a lifetime penalty. Today, I'm answering the 5 questions I hear most from people in their first year on Medicare, starting with the simplest and ending with the one that trips up even careful planners. Stick around for that last one. It involves your health savings account, and most people don't find out about it until it's too late. I'm Margaret Hale, and this is what nobody hands you in a pamphlet. Let's start simple. How much does Medicare Part B cost in 2026? The standard Part B premium is $202.90 a month, up $17.90 from $185 in 2025. You'll also pay a Part B deductible before Medicare starts sharing costs. In 2026, that deductible is $283, up $26 from $257 in 2025. Most people pay the standard premium. If your income is higher, you may pay more. I'll cover that later. For now, remember 2 numbers: $202.90 a month and $283 a year before coverage kicks in. Write them down. They'll come up again when we talk about penalties, because those penalties are calculated as a percentage on top of this base premium. Second question: what happens if I miss my enrollment window? If you delay Part B without other qualifying coverage, you pay a 10% penalty on your premium for every full 12 months you could have signed up but didn't. This usually lasts as long as you have Medicare, for life. For example, someone who waited a full 24 months pays a 20% penalty. In 2026, that means $243.50 a month instead of $202.90. Part D has its own penalty. 1% of the national base premium, $38.99 in 2026 for every month you went without drug coverage for 63 days or more. If you missed your window, you can enroll during general enrollment January 1st through March 31. Good news for 2026. Coverage now starts the month after you sign up, not months later like it used to. Get used. Third question, and this trips up more people than any other. Can I sign up for Medicare during the fall open enrollment period, October 15th through December 7? No. That window is only for switching a Medicare Advantage or Part D plan you already have. You cannot use it to enroll in Medicare for the first time. If you're new to Medicare, you sign up during your initial enrollment period, the 7 months around your 65th birthday. Miss that, and your next chance is general enrollment, January 1st to March 31st, with a penalty attached if you didn't have other qualifying coverage. So don't wait for the fall commercials. If you're turning 65, your window is tied to your birthday, not the calendar everyone else follows. Fourth question: what is this Medigap window everyone talks about, and can I buy a supplement plan later? You get a one-time 6-month Medigap open enrollment period. It starts the month you're both 65 and enrolled in Part B. During those 6 months, insurance companies can't deny you a policy or charge you more for pre-existing conditions. Once that window closes, most insurers can deny you coverage entirely or charge much more unless you qualify for a guaranteed issue right. It's different if you kept employer coverage from a job with 20 or more employees. You get an 8-month special enrollment period after that coverage ends. But for most people, this 6-month window is use it or lose it. Mark the date the day you enroll in Part B. Now, the hardest question, saved for last because it has 2 parts. First, why did my Medicare premium jump so much when my income didn't really change? In 2026, IRMAA surcharges kick in once your income tops $109,000 for single filers or $218,000 for joint filers. It's a hard cliff. Even $1 over the limit triggers a surcharge on both Part B and Part D for the entire year. Here's the twist: your 2026 premium is based on your 2024 tax return, not your income today. Many new retirees get surprised because they had one high-income year right before they retired. If your income has since dropped, say because you stopped working, you can appeal. File Social Security Form SSA 44 within 60 days of your IRMAA notice. The second part of that hardest question, your health savings account. Once you enroll in any part of Medicare, even premium-free Part A, you can no longer contribute to an HSA. Here's what most people miss. Applying for Social Security automatically enrolls you in Part A, and Part A can be backdated up to 6 months before your application, though never earlier than the month you turn 65. If you kept contributing to your HSA during those 6 months, the IRS calls it an excess contribution, taxed at 6% for every year it stays in the account. The fix? If you plan to delay Medicare and keep contributing to your HSA, stop all contributions, yours and your employer's, at least 6 months before you apply for Medicare or Social Security. Let's put these 5 answers side by side. A standard Part B premium in 2026 is $202.90 a month. Wait 24 months too long, and that becomes $243.50 a month. Every month, for life. That's the cost of one missed window. None of these 5 mistakes require you to pick the wrong plan. They're all about missing a date. Your initial enrollment period, your 6-month Medigap window, or the 6 months before you apply for Social Security. The good news is every one of these is avoidable if you know the deadline before it passes. That's really the whole lesson from 30 years of watching people navigate this system. It's not complicated. It's just unforgiving of missed dates. So what's your one next step? Find your 65th birthday month or the month your job-based coverage will end and count backward from there. That tells you your enrollment window before it becomes a penalty. Download the free retirement deadline checklist, link in description. It covers every deadline we talked about today, from initial enrollment to your HSA cutoff to IRMAA appeals. This video is for education only and is not financial, tax, or medical advice. Some visuals and narration are produced with AI assistance. Talk to a licensed advisor about decisions specific to you. If this helped, subscribe for more plain English retirement guidance. I'll see you in the next one.